Hello, and welcome to this learning module. In today's session, we will discuss the changes that people experience physically and developmentally at various stages in life. This video is intended to supplement any readings or coursework assigned by your instructor. Upon successful completion of this learning module, students will be better able to list key growth characteristics for each lifespan stage, describe common developmental milestones for each stage of life, and cite common health problems in each stage of lifespan progression. From conception and moving forward, humans continue to grow and develop. In this context, growth refers to physical changes like an increase in height and weight, which can be quantitatively measured. Development is the broader process of functional and behavioral changes, including gaining new skills, improving memory, and learning to express emotions, which are qualitative changes. EMS providers must have a working knowledge of common growth and development characteristics for each lifespan stage to help them formulate an assessment and management plan for a patient of any age. The lifespan stages and corresponding age ranges are seen in the table on this page. From birth to 1 month of age is the neonatal stage of development. A full-term newborn weighs 6 to 8 pounds at birth, and their head accounts for approximately 25% of their weight. Neonates will lose approximately 5 to 10% of their body weight in their first week secondary to fluid loss. After 2 weeks, neonates will grow at a rate of about 1 ounce per day. Prior to birth, fetal circulation bypasses the lungs and is provided by the mother through the placenta. In fact, their lungs are filled with amniotic fluid that gets squeezed out during the birthing process. Their first breath expands the lungs and helps push out the remaining fluid. This first breath is also responsible for closing the circulatory bypass to the lungs. Neonates are born with several involuntary reflexes that help them survive and adapt to their environment. The Moro or startle reflex results in extension and flailing of arms and legs in response to a sudden noise or loss of support. Turning their head and opening their mouth when their cheek is touched is called the rooting reflex. Neonates will also make sucking motions when something touches their lips. Both the rooting and sucking reflexes play a key role in feeding. Neonates also exhibit a palmar grasp reflex that happens when an object is placed into their hands. To facilitate delivery at birth, the cranial bones are not fused together, but are connected by flexible connective tissue called fontanelles. As the child develops, the cranial bones will fuse together, forming the cranium by 18 months. Until then, the soft spot on their head remains relatively unprotected. The image on the top illustrates the fontanelle locations between the cranial bones, while the picture on the bottom allows us to see them in an infant. From age 1 month to 1 year, we are in the infant stage of life. An infant's first year marks a period of profound physical transformation, progressing from a helpless neonate to a mobile, curious toddler. At 1 month, an infant's movements are jerky and driven primarily by newborn reflexes. They can briefly lift their head while on their stomach and typically keep their hands clenched in fists. Over the next 6 months, they develop greater motor control, learning to purposefully reach for objects, grasp toys, and roll over in both directions. By 6 months, many can sit up with support and bear weight on their legs. The latter half of the first year is defined by increasing independence through mobility, as infants master sitting independently, start to crawl, pull themselves up to stand, and cruise along furniture. Approaching their first birthday, many infants take their first wobbly steps. Their hand-eye coordination refines into being able to hold objects between their thumb and index fingers, allowing them to begin to feed themselves finger foods. In addition to physical growth, an infant's developmental landscape grows with a range of social, emotional, and cognitive milestones. Early social development includes a purposeful social smile around 2 months in the formation of attachments to primary caregivers. As they grow, infants become increasingly interactive, beginning to laugh around 4 months and engaging in back and forth conversations of babbles by 6 months. Cognitive leaps include the development of object permanence, which is the understanding that an object still exists even when hidden, which happens around 9 months. By their first birthday, infants recognize their name, respond to simple requests, and may have a vocabulary of a few simple words like mama and dada. This remarkable year transforms an infant from a physically dependent newborn to a communicative and mobile individual. actively exploring and learning to understand the world around them. The table on this page summarizes some of the physical and developmental characteristics common in the first year of life. From ages 1 to 3, toddlers undergo a shift from tentative steps to confident and coordinated movement as their physical abilities continue to expand. Physically, the first year is marked by transitioning from a wide, wobbly gait to a more stable and independent stride by 18 months. Following this, toddlers master running, jumping with both feet, climbing furniture and stairs, and kicking a ball. Fine motor skills also see significant development, allowing them to stack blocks into increasingly tall towers, scribble with crayons, and manipulate smaller objects. By the age of 3, their dexterity advances to the point of turning doorknobs, using spoons with greater control, and copying simple shapes. This enhanced physical control allows toddlers to more actively and independently explore their environment, boosting their autonomy. Cognitively and socially, this period is characterized by tremendous growth in language, independence, and emotional expression. Toddlers progress from simple words around 18 months to forming 2 to 4 word sentences by age 2. Their vocabulary continues to grow rapidly. They also begin to follow 2 or 3 step instructions, sort objects by shape and color, and engage in imaginative pretend play. Socially, toddlers start to recognize themselves in mirrors, become more aware of their surroundings, and show greater independence, which is often expressed through the increased use of the word no and temper tantrums. While they engage in parallel play or playing alongside other children, direct social interaction and the ability to share emerge as they approach age 3. This explosive development transforms them into expressive and inquisitive individuals, with their brain developing significantly in these foundational years. Between 18 and 24 months, toddlers begin to understand the concept of cause and effect, and they also begin to recognize gender differences. During this stage, toddlers lose their passive immunity, and viral infections, including colds, develop frequently as their bodies begin the acquired immunity process. Choking and accidental poisoning are hazards for this age range because their natural curiosity involves putting objects in their mouths. During the preschool years, ages 4 to 6, a child's physical abilities become more coordinated and refined, enabling greater independence and complex play. Gross motor skills advance significantly as preschoolers move from simple running and jumping to mastering more complex movements like skipping, hopping on one foot, and climbing playground equipment. Fine motor skills also see remarkable progress. By age 4, many children can use scissors to cut along a line, manage buttons and zippers, and hold a crayon with a proper grasp. These skills sharpen by age 6, allowing them to draw more detailed pictures of people with more body parts, copy shapes like triangles and diamonds, and even begin to write some letters in their own name. This newfound control over their bodies enhances their ability to engage with their environment and participate in more sophisticated activities. The cognitive and social landscape of a preschooler is marked by rapid advancements in reasoning, social awareness, and language. Towards the end of this period, they move away from egocentric thinking and develop a greater understanding of others' perspectives. This period is also a time of explosive cognitive and social emotional growth, with preschoolers developing a richer understanding of the world and their place in it. Their language skills blossom and their vocabulary expands to include thousands of words. Preschoolers use longer and more complex sentences to express their ideas and feelings. They become increasingly social, shifting from parallel play to cooperative play where they interact directly with peers, sharing and taking turns more effectively. A preschooler's imagination becomes more elaborate, and they engage in complex make believe games which help them process the world and explore distinct roles. While they develop a better understanding of rules and others' feelings, their emotions can still be intense and fluctuate, and they continue to test boundaries. By age 6, they are more capable of expressing frustration verbally rather than physically, displaying a growing sense of self control and awareness. During the school-age years of 7 to 12, a child's physical development shifts from mastering basic movements to refining more complex and coordinated motor skills. Around ages 7 or 8, children continue to sharpen skills like riding a two-wheeled bike, catching a ball with one hand, and improving their balance and coordination. By the later stages, closer to age 12, Physical abilities become more specialized and powerful with better stamina, strength, and reaction time. Many become adept at organized sports and complex games requiring specific athletic abilities. This phase also marks the onset of puberty for many children, particularly girls starting as early as 8 and boys around age 9. These hormonal changes trigger growth spurts and the development of secondary sex characteristics, which can make children feel awkward or self conscious about their changing bodies. Cognitively and socially, the 7 to 12 age range is a time of profound growth, moving from concrete to more abstract thought and expanding social circles beyond the family. Children develop the ability to think logically about tangible situations, understand cause and effect, and grasp concepts like understanding that properties of objects don't change just because appearance does. Their social world becomes increasingly important as they form and navigate deeper, more complex friendships and learn to cooperate and compromise with peers. Language skills become more sophisticated with growing vocabulary and the ability to tell complex stories and understand humor. Later in this stage, children begin to develop a stronger sense of self, question rules, and become more interested in their identity and personal goals. They also experience more nuanced emotions and start to internalize a sense of right and wrong, becoming more empathetic to others' feelings. During the adolescent years between ages 13 to 18, a young person's body undergoes a dramatic transformation driven by hormones that signal the final major growth phase before adulthood. Both males and females experience significant growth spurts, with boys typically starting their growth later and continuing to grow into late teens, while girls' growth typically peaks earlier. Puberty triggers the development of secondary sexual characteristics, such as increased muscle mass, deepening voices and facial hair in boys, and breast development, wider hips, and menstruation in girls. While these changes are a natural part of maturing, the varying timing and rates of puberty among peers can lead to self consciousness or body image concerns. By the end of this period, most adolescents have reached their full adult height and physical maturity, including increased strength and stamina. Alongside these physical changes, adolescents experience profound cognitive and socio-emotional development as they transition from concrete thinking to more abstract and complex reasoning. In early adolescence, thoughts are often focused on personal experiences and immediate social circles, but by late adolescence, thinking expands to include more philosophical and global concepts. They develop a stronger sense of personal identity, begin forming their own ethical codes, and set long-term goals for their future. Socially, peer relationships become increasingly central to their self esteem and sense of belonging, often taking precedence over family relationships as they assert more independence. They navigate more complex friendships and romantic relationships, testing boundaries and exploring their sexuality while learning to manage intense emotions. Peer pressure peaks between ages 14 and 16, which can lead to high risk activities, including smoking or vaping, illicit drug use, and unprotected sexual relations. The risk of eating disorders, depression, and suicide also increases. In early adulthood, spanning ages from 19 to 40, individuals reach their physical peak before a gradual decline begins in their 30s. In their 20s, the body achieves its maximum physiological function, including peak muscle strength, cardiac efficiency, and sensory abilities. However, around age 30, subtle signs of aging begin to emerge, including reduced immune response, slower recovery from physical exertion, and gradual declines in vision and hearing. Lifestyle choices during this time include diet, exercise, and stress management that significantly influences the rate of this physical decline. This period also marks a peak in female fertility, which begins a gradual decline after age 30. For men, a gradual decline in sperm quality and concentration typically begins after age 35. This stage is defined by significant cognitive and socio-emotional milestones, marked by increased autonomy, emotional stability, and the formation of intimate relationships. Young adults solidify their identity, explore career options, and navigate significant life events like entering the workforce, forming long-term partnerships, starting families, and establishing households. Brain development, particularly in the prefrontal cortex, continues until the mid-20s, leading to improved impulse control, decision-making, and emotional regulation. Later in this stage, individuals become more adept at balancing possibilities with practical realities. The pressures of balancing these responsibilities, however, can lead to increased stress. Early adulthood is a crucial period for establishing health habits, but it also comes with notable health concerns. Mental health issues, including anxiety and depression, are prevalent during this time due to the stresses of financial worries, achievement pressures, and establishing an identity. Substance use disorders are also a significant concern, with this age group having some of the highest rates of alcohol and drug misuse. Unintentional injury, often from motor vehicle accidents, is a leading cause of death in young adults. Later in this period, chronic conditions associated with obesity and a sedentary lifestyle, such as hypertension, high cholesterol, and type 2 diabetes, become more common. Cancers, including testicular, cervical, and melanoma, are also more common in this age group than many people realize. Middle adulthood, which typically spans ages 41 to 60, is characterized by a mix of physical changes and a shift in developmental focus. Physically, individuals begin to experience a more noticeable decline in bodily function. This includes slower metabolism, which can lead to weight gain even if a person's diet has not changed. Vision and hearing may also decline, with many people needing reading glasses. Other changes include a loss of muscle mass and bone density, which can be particularly significant for women due to hormonal changes. Menopause in women and a gradual decline in testosterone in men mark a decline in reproductive capacity. Visible signs of aging like graying hair and wrinkles also become more prominent. Cognitively, middle adulthood is not a period of uniform decline. While some aspects, such as processing speed and the ability to solve new problems, may decrease, other cognitive skills improve or remain stable. This includes an increase in the accumulated knowledge and experience gained over a lifetime. This expertise often allows middle aged adults to excel at complex, real world problem solving. This stage is also a time of significant socio-emotional development as individuals grapple with issues of generativity, seeking to contribute to society and guide the next generation. Many people also reevaluate their life goals and priorities, often leading to a desire for more meaningful relationships and a greater focus on emotional well-being. Health concerns become a central theme in middle adulthood. This period sees an increased risk for chronic conditions such as heart disease, hypertension, high cholesterol, type 2 diabetes, and various forms of cancer, which are the leading causes of death in this age group. Osteoporosis and arthritis are also common issues. While genetics play a role, lifestyle choices such as diet, exercise, and stress management have a profound impact on health outcomes. The percentage of adults with a disability also increases with age. Engaging in regular physical and mental activity is crucial for maintaining both physical and cognitive health during this stage of life. Older adults experience significant physical changes, including decreases in bone density, muscle mass, and flexibility, which can increase the risk of fractures and falls. Cardiovascular changes are common, with blood vessels losing elasticity and the heart working harder, potentially leading to conditions like hypertension. The immune system also becomes less robust, making older adults more susceptible to infections and slowing recovery times. Sensory changes affect vision and hearing, with many older adults experiencing farsightedness, cataracts, hearing loss, and difficulty processing rapid speech or conversations in noisy places. Additionally, slower metabolism and a decline in kidney and digestive function can contribute to weight gain and nutritional challenges. Health changes in this age group include a higher risk for chronic conditions such as heart disease, cancer, diabetes, arthritis, osteoporosis, and dementia, including Alzheimer's disease. The risk of polypharmacy also increases as older adults often take multiple medications, raising the potential for side effects and drug interactions. Mental health can also be impacted, with chronic pain or illness increasing the risk of depression and anxiety. However, many older adults maintain good overall health and positive well-being, particularly those who remain physically and mentally active and engage in social connections. A healthy lifestyle, including regular exercise, a balanced diet, and staying current on immunizations, can help mitigate many age-related changes and improve quality of life. From a developmental perspective, older adults experience both cognitive shifts and socio-emotional adjustments. Some cognitive abilities, such as processing speed and working memory, decline. This period is a time for reflection where individuals evaluate their lives for meaning and satisfaction. For older adults, grieving the loss of loved ones is often a complex and compounding process, resulting not only from the death of spouses and friends, but also from concurrent losses of independence or health. This accumulated grief can intensify feelings of loneliness and isolation, posing significant risks to both mental and physical well being. In this chapter, we have provided a brief overview of key growth and developmental milestones for each stage of life. We also discussed general medical concerns for each developmental stage. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, consider going back to review any content that you struggled with. Your textbook is a wonderful resource and you should consult it if you would like more information on this topic. Thank you for watching this video.